Well, hello everybody. We're now live on YouTube, I think. So, welcome. There we go. So, anyways, one day I'll get this right. Right now, I haven't really advertised anywhere that I'm going live. I just told a few people last night that were listening to us. But today's been a great day because, well, as you can see, doctors in New York have been treating hundreds of patients with steroids, okay, a certain type of steroid. And we'll be getting into that a little bit later. But, anyways, they've been trying to get the attention of the US government. Three times they tried to get their attention in the last month and a half. And now, finally, on May 6th, the senator that was interviewing them in this committee meeting for Homeland Security actually and Government Affairs actually sent it again. So from May 6th to now, May 15th, the US government is still not telling anybody about this finding steroids. Okay. And the way that they did this, it was really amazing because this company developed a new method of being able to test viruses or whatnot and see what is actually infecting them. Okay. So, anyways, their methods look very promising for any type of virus that'll come up or bacterias affecting people. So, anyways, what I want to do tonight is explain to you a bit of what's been going on and so that you can learn to identify government propaganda. And this is all the governments are involved. Okay. Nobody's a saint here. So, anyways, with the other findings that we had this week in regards to the World Economic Forum and the matrix that they implemented over years and years on how they were going to set up their new world government, which has been established since 2017 in Dubai. Okay. So a lot of people might not know this stuff and it might just, go over your head for now. But what I'm asking you is to make sure that you keep an open mind. We have a lot of people who are even disqualifying the doctors in California that came out. And ever since then, other doctors have come out and told the truth. And then we find out that the hospitals, um, that the US government is actually paying for assumed cases of COVID. So it doesn't matter what you have. They're going to assume that you've got COVID. So the hospitals were getting $13,000 per assumption. Okay. And then if they actually had a case, it would qualify as 39,000 and some dollars that they would get for a case of COVID. So, and this was to inflate the numbers. So the propaganda around this virus to vaccinate everybody and to keep us monitored, have us under these programs is totally ridiculous. So there are different things that can help cure people of this virus. And what they're finding is that it's nothing more than just another type of influenza flu. And but when you look at the circumstances and some of the research that I've done, I'm I'm suspecting a connection to C. difficile. Okay, so if you combine those two things together, it might end up as COVID. However, I'm not a scientist. And all I've been doing is I've been reading research, okay, from over the years. And then with the beginning of SARS. So when we're looking at SARS, okay, we need to go back to 2003 when it came out. And the fact that in year 2000, we started using human feces as fertilizer, okay, in manure. And oh, they're saying we have nothing to worry about. Well, I think that because a lot of people are testing positive, but not everywhere. And I'm going to replay the video that I've just made, and I'm going to send this out, okay? Because people need to know that we have a solution, okay, to stop the propaganda, this new world order, and being dictated to by private corporations. And I mean, the amount of work that they've done is unbelievable. They've had hundreds of thousands of people doing their work, doing their bidding for years and years without them even realizing what they were doing, from what I can see. So, to make a long story short, if we start connecting the dots, it starts to make sense. And the fact is that when we're looking at Canadian governance, which is what we're going to talk a little bit later on, and what I'm going to try to do is try to focus things per segments that we're going to be doing so that you get a better understanding of why, I'm with the Canadian People's Union and the Power Shift. Okay.ca. So the powershift.ca, and what we're doing is that we found a solution. When we saw back in 2008 what was happening, I had sent Stephen Harper a letter, a registered letter, and to all the premiers and the ministers, stating that we're going to have to remove final decision making authority out of the hands of our government because of their incompetence, especially in regards to food safety. And I came on board, like I said, I was looking at getting my hospital project underway. And then I found out that, you know, we were going into the security prosperity partnership agreements with Canada and Canada, USA, and Mexico. And then we were letting go of our food standards. So because Canada had the highest standards on this side of the West, okay, we had to trash our standards and lower them to accept Mexican and US foods. And I would like to dedicate these segments to Shiv Chopra, okay, and everybody, John Jones, everybody who is working for, you know, food sovereignty and to protect our foods against things like Monsanto. And who owns part of Monsanto now but Bill Gates? Who is Monsanto? The Rockefellers. Uh, who backed up Mackenzie King back in the 1920s and 30s? But the Rockefellers. I mean, Mackenzie King worked for the Rockefellers. So, these things, if you don't study the history, you would never know these things. And it'd be hard to, how can I say, make common sense or see what's been going on over the years in Canada. So this is why I've been working on this since 2007, and trying to stop what was happening, and then people were not listening to us. I designed the Citizens Convention of Consent back in 2014 because I knew that that would be our only option. Okay, so throughout the years, I kept researching, and yes, I came full circle. We're still having to do the Citizens Convention of Consent and getting all the citizens together if we want our rights in Canada. So this is where the Canadian People's Union comes in and the power shift. So the power shift is a way for the Canadian citizens, and people worldwide in other countries can do the same because we're all under the same like international laws, right? So if you're looking at the decolonization, in Canada, we were given self-governance, not independence. Like we're independent and we can self-govern, but there are still some discrepancies there, which Mr. Trudeau and his daddy fully knew about and know about. So back in 1982, the Trudeau said that we're bringing home our Constitution, and actually our Constitution is a Constitution of the British Crown. It's an act of the British Crown. And technically, it still belongs to the UK under strict constitutional law. So this is why, a lot of people are getting the wrong information and everything. And so we're here to, we're not going to tell you all of the stuff we know because there's way too much, but at least enough for you to understand that in Canada right now, even though we have, back in 1982, we were given our rights and freedoms. However, some people, even lawyers are misguided about the fact that the Constitution, it says this in the Constitution, and this is how it's got to go. However, they forget one thing, and that Canadian citizens in Canada, even though we have uh, individual human rights, we do not have collective rights. Okay. And we were supposed to have collective rights since 1960, or actually 1930, 1931 with the Statute of Westminster, but we were never given that. Okay. And we were never explained that. And then in 1960, yet again. So in 1960, leading up from 1960 to now, the Canadian government was supposed to give self-determination and self-governance to the First Nations in Canada. Okay, that was their right. And as well as the French people, because they were a distinct society and here before the English came. So the French in that sense had kind of a right, but still the first right belongs to the First Nations. Okay, so in my research, this is what's come up. And then we found out exactly what transpired between Pierre Trudeau and the UK back in the 1980s. And it made it very interesting to find this out. And this is why it's so important that people understand that in Canada, we have our human rights. However, they really don't fall under human rights at the international level because they gave us their version of our rights and freedoms. Okay. So even though they coincide pretty much with the international laws, they still give us their version. And if you read the fine print, it does say that the government can take away our rights at any time they want. The Canadian government. Okay. So it doesn't matter what's written in that Constitution. They still have the last say. And that's what my mission has been about. And it was to find us a solution because we can see what was happening worldwide. All the research a lot of good people did, like, people like Shiv Chopra who fought tooth and nail and unfortunately passed away before this happened. And in a way, I'm kind of glad in the sense that he's not here because this was probably just eat him inside out. However, now with the good news about the COVID and that it's not so bad, and we've been used and we were manipulated by our governments when they fully knew what was going on. Okay, so now it's up to the Canadian people. If we want to do something about this, we need to be able to get together and unite under a collective agreement, a legally binding contract between each citizen. Okay, and this is where our Citizens Convention of Consent on the power shift happens. So what we've done is we've created this legal document that you can sign online. You can only sign it online because it gives us an accounting, and then it gives us only a specific number that we can bring to the courts without divulging everybody's names. Okay, so it's protected that way. And the thing is that once we do this online and by 51% of the Canadian citizens, then we have the right to politically change our system of governance and have the right to final decision-making authority. Because right now, even though we have our rights and freedoms, it doesn't give us the right to, one, sue the government sue Justin Trudeau himself. We can't do that. He's got immunity. Parliamentarians all have immunity. And this is what a lot of people don't know. We can sue the government itself, yes, as a whole, but at the same time, the government has rights that you'll only find out in court once you're already there and spent most of your money. Okay. So there's such a thing in Canada as, they say that we have democracy. The only ones that have a democracy in Canada are the parliamentarians. Okay. Because every 4 years, when we vote, we give away our rights to these politicians for the term of their elections. It's 100% blank check. There you go, make all the decisions, and then you can jail us in our homes under a pretext of a pandemic. Who's going to argue, right? Make everybody heroes and pat everybody on the back, and you've been such good people. Anyway, long story short, I'm going to allow you to, not allow you, but I'm going to show you the video again from the committee in the United States. And please listen very carefully to the words being used, to what they're saying. And then what I'm going to do is, after I just uploaded the video today, we ran out of, we didn't have hydro for about like 3 hours because somebody took down a hydro pole. And so I was a little bit late, and I apologize for that. But I was hoping all of the information on this video and for you to be able to see afterwards and download some of the information. So I haven't had a chance to put up the PDF documents from all of the testimonies yet, and actually the minutes, but they're there. And then from the study, some of the findings that they have. So they're still waiting for peer review on the fact that COVID was treated with a certain steroid, and to be able to proceed with that, they were supposed to only follow certain rules from the UN. And I want you to listen very carefully to what the doctor says, because he'll come up and say his first obligation is to his patient. So they actually went against what the UN and the FDA and the World Health Organization said for them to do, like the protocols that they were supposed to do in the United States. And so they had to kind of cover themselves. So we're going to have to really stand behind these people, and other doctors from different countries, different areas, even in the United States, tried the steroids. It worked. Some other steroids did not work, but this type did. And the kind of technology they've come up with to be able to identify viruses and what can be used with them that already exists, is actually amazing. And the thing is who needs vaccines? There's no need for vaccines for this. Okay. But they really want to push the vaccine, and that's where the propaganda comes into. So you're going to see them explaining what they're doing, and then you're going to have Dr. Corey, who will be giving his testimony. And then you'll have a gentleman that works for John Hopkins University Hospital, and like the center, and who brought us Event 201 with Bill and Melinda Gates Foundation. So anyways, he kind of looks like an idiot. I mean, you'll see for yourself. I mean, he must have been totally deflated after he heard what Dr. Corey had to say. Anyway, Dr. Fauci, I think you deserve jail time. And, by the looks of this and connecting all the dots, there's one hell of a good court case waiting to happen here in Canada against our government. And, they want to blame the hospitals or the doctors or whatever for other things like C. difficile. Well, excuse me, it all comes back to the pharmaceuticals. Everything leads back to the pharmaceuticals and our government for allowing all of this to happen, while I'm sure they knew more than what they're telling. So I'm going to play the video, and I hope you enjoy it. And then I'll come back after, and then I'm going to go through the documents. Okay. So I'm going to do a screen share here. And okay, share. Here we go. Try to get this organized and start the video.
Hello, everybody. I want to welcome everybody to this roundtable, the first one we've ever done that's completely on the internet via video. We tested out this capability yesterday. It looks pretty slick, but I would anticipate a few hitches. But everybody, I think we can handle this if we just kind of follow the rules. And so let me quickly lay out some of the rules here. First of all, if you'll take a look at the circles on the bottom of your screen there, if you have a mouse and you get your little arrow up and going, there are two icons at the far left. There's a microphone and a video. If you're in attendance as a member or a witness, keep your video unmuted. I just muted mine, just unmuted it there. So kind of see how that works. Do not touch your audio. You are automatically, everybody's muted until it's your turn to speak. And we're doing that not to be cruel, but just because it makes an awful lot of sense in terms of being able to not have a bunch of chaos during this roundtable. Again, because of that disruption, sensitive multiple microphones, don't touch that mute button. If you'd like to speak at another time, there is on the attendee list at the very bottom, if you take a look, it's very small, but there's a little hand. There's three little squares and a little hand. If you click on that, I'm clicking on mine right now, that will signal either the witnesses or me that you want to make a point. Certainly, I don't have a problem with witnesses doing it. I'm hoping members do it sparingly. Again, this is not going to be like a normal hearing, so not quite the same kind of free flow that we normally have. And what I would urge all the members is to direct your questions at a particular witness. Again, it's going to be pretty hard to have this wide open. So if you got a particular question, ask it to a particular witness or possibly witnesses, but be very specific. And we are going to be very mindful of the time. I want both the senators and the witnesses to be, watching that 7-minute clock run down. The favorite technique of senators is to ask about a question that requires about a 5-minute answer right at the 6:59 mark. Don't really want to allow that. We can take those types of questions under advisement for questions for the record. So with that, Dan, if you can quick put up, I've just got 4 little charts, should really surprise nobody. But I just want to start out with some basic information, because what this hearing really is, from my standpoint, all about is, as we develop data, let's face it, when COVID, when we found out about that, brand new virus, nobody ever heard about it, pretty darn scary. You see folks in China in moon suits. And so it's that fear of the unknown that is driving so much of the policy right now. And I have not been critical of really any a policymaker who's had to make very tough decisions with very limited information. But as we're gathering that data now, and that's what this hearing is all about, is we should take that new information, that new data into account in terms of how do we modify our policy, as well as what I've been advising for quite some time is we have to look at the totality of the harm being done, not only just the tragedy from a standpoint of lives lost and lives destroyed, but also the economic destruction, the human toll that is taking as well. So I've just got 4 quick slides, just some basic information to kind of try and keep everything in perspective. The first one is the one on the screen, causes of death for 2018. You notice 2.8 million Americans died that year. That's pretty typical. It's almost 8,000 people per day. I think the largest number of per day deaths for COVID is slightly over 2,000. So you can understand how significant an issue, the significant tragedy that COVID really is. Next slide. This is just the 9-year history off the CDC website of seasonal flu. I think it's important to point out the magnitude of that problem. I think the figure is only 40% of Americans get vaccinated for this. The vaccine's not 100% effective. And you can see how many Americans die on an annual basis over the last 9 years. In total, 337,000 Americans have lost their lives due to seasonal flu over the last 9 years. That's an average symptomatic case fatality rate of 0.13%. You can see, look in the past years, kind of the lowest level is about 0.1%. A really bad flu season is almost 0.18%. I think those numbers are important to keep in mind as we take a look and we eventually find out what not only the case infection rate is with COVID, but what is the actual infection fatality rate, which as the denominator grows and that infection fatality rate decreases, hopefully some of the fear will be reduced. Again, I'm not saying the fear is not irrational. It absolutely is legitimate. But in order to really regain our economy and open it back up, we do need people looking at this from a proper perspective and hopefully with an effective therapy and cure. And we're going to have Dr. Corey on to talk about some pretty hopeful signs in terms of therapies in the hospital. Hopefully we can also bring down that fear level so people can go back to a more normal type of life. But you can see 337,000 deaths over the last 9 years just due to seasonal flu. Next. This is just, and these are up-to-date figures as of this morning. So here's a state and territory comparison. Unfortunately for New York, it leads the pack in terms of number of cases, in terms of number of deaths, in terms of percent of the population that are known cases, 1.7%, percent of deaths of the population, 0.13%. The lowest percent of population in terms of cases is Hawaii and Montana at about 0.043 compared to New York's at 1.7. And in terms of percent deaths, there are a lot of states, fortunately, that are only 0.001. On average, America is about 0.36% of the population is reported as a case, and 0.02 of the population has actually died from COVID. And then the final chart, Dan, these just country comparison. I got 12 countries on here that I've been tracking pretty much on a daily basis. I'm going to throw Russia and China out in terms of actual comparisons because I'm quite honestly not sure how accurate their reporting is. But I think the other nations, and let's face it, everybody's going to have different standards on how they report these cases and how they collect information. But I think it's important to point out when you take a look at the cases as a percentage of population, the United States ranks number 3 in terms of worst. In terms of highest percentage of the population that's been infected, but we rate 7th when it comes to percentage of deaths or percent of population the deaths are at 0.02. I want to point out Sweden because Sweden definitely took a different approach to responding to COVID. They basically took the approach of we will quarantine the sick, we will protect the vulnerable, and the rest of us will basically go about our lives, obviously following the guidelines of social distancing and sanitizing, personal hygiene, that type of thing. And again, these numbers, we don't know where they'll eventually turn out, but Sweden, in the scheme of things, is not doing that badly. In terms of percentage of their population that have a confirmed case, they rate 8th at 0.26. And in terms of percent of their population that have died, they rate 6th on this list out of these 12 countries at 0.03. So again, that's just some basic information. I try to get that to all the witnesses and senators just to have to again put all this in perspective. With that, I'll turn it over to Senator Peters, my ranking member, for his opening comments.
Thank you, Mr. Chairman. The coronavirus pandemic has certainly profoundly altered our world. It's putting millions of people out of work, threatening the future of small businesses, exposing serious inequities in our healthcare system, and is taking the lives to date of more than 71,000 Americans. And like so many of us, I'm ready to start getting America back to work, but we need a clear plan, backed by science and by data. That will give us a roadmap to safely reopening our economy in stages. While cases in some parts of the country appear to be plateauing, we know that there are other communities that are experiencing rising numbers right now. We currently don't have enough tests to fully understand how many people have contracted or succumbed to the virus. We are still struggling to get enough masks, gloves, and other personal protective equipment to our frontline workers, and we don't yet have the supplies needed to prevent a resurgence of this virus. We need a robust contract tracing plan to identify possible exposure to coronavirus and prevent further spread that could result in another wave of cases, hospitalizations, and unfortunately, tragic deaths. We need to protect and grow the capacity of our hospitals to deal with these localized outbreaks, and we need to back production of life-saving drugs and medical supplies we need to take back that production from China. We need to develop and deploy a vaccine to inoculate Americans who have not contracted the virus. And we need clear data and metrics that are backed by science to tell us what is working and what is not. And we need to push to use these best practices to help our small businesses out so that they can keep their employees safe and their customers' confidence. This critical information and the lessons we have learned will help create a plan for how we can safely reopen. Without this data-driven plan, we risk undermining the progress that we have made and repeat the unbearable loss of human life and economic shock that we are currently experiencing. Despite all this hardship, I'm encouraged every day by the workers and the entrepreneurs in my home state of Michigan that are finding ways to keep their workplaces safe and, as we speak, are retooling their businesses to meet the needs of frontline responders. I've talked to many of them over the last few months, and they all are saying they need clear guidance by reliable data to back up their actions. We also must remain focused on the unequal impact of this virus and how it impacts communities of color. In Michigan, Black residents make up 13% of the population, but represent 40% of the deaths from COVID-19. This disparity is rooted in systemic inequity, and we must change our plans in response to the data and protect these communities, not simply accept the inequity of the inevitable. These decisions are a matter of life and death, and we cannot accept tens of thousands more coronavirus deaths as unavoidable. Just as we can't accept the reopening of our economy while minimizing risk isn't possible. We must have a clear path that provides people with guidelines that are backed by science to help us reopen. I look forward to today's discussion and to continuing to work with all of my colleagues to ensure that we're taking the appropriate steps necessary to allow us to safely reopen our economy while protecting our most precious resource, the American people. Thank you, Mr. Chairman.
Well, thanks, Senator Peters. I'd really like to thank all of our witnesses for the time you've taken out of your day just to participate in this, but also the time you've spent, first of all, speaking to these issues. I think all but one of you I've seen on some TV show in the last couple of weeks, but you've put your lives and you've done a lot of work to try and educate the public, and I truly appreciate that. The one outlier will be our first witness, Dr. Pierre Corey. I just spoke with him last week. He's affiliated with the University of Wisconsin-Madison, but he's a New Yorker, and he's currently on the front lines in New York. And the reason I wanted to put him first is to give us a little bit of hope. What he is talking about in terms of effective therapy once individuals have been hospitalized, I think is very encouraging. And I wanted to give him enough time to kind of speak to that before we kind of open up into the sort of the main purpose of what this hearing was all about, which was really taking a look at the data and taking a look at the policy choices and decisions that we've made and that we need to make based on what that information, what that data tells us and instructs us. So again, our next witness is Dr. Pierre Corey. He is the Chief of Critical Care Service and Medical Director of the Trauma and Life Support Center and Associate Professor of Medicine at the University of Wisconsin School of Medicine and Public Health. He is board certified in critical medicine, pulmonary diseases, and internal medicine. He previously served as director of the advanced courses sponsored by the American College of Chest Physicians. Dr. Corey received an MD at the St. George's University School of Medicine. Dr. Corey.
All right. Yeah. Thank you. I believe I'm unmuted. So thanks for the invitation. I really appreciate the opportunity to talk about COVID. I do want to start out by saying that I'm speaking today as part of a group. I have bonded with 5 colleagues. They're some of the most well-known and highly published and most impactful critical care experts in the world. And I do want to make sure that I mention them. So one is my colleague, Dr. Paul Marek. He's from the Eastern Virginia Medical School, very well known in our specialty. Also, Dr. Umberto Meduri, who's from the University of Tennessee in Memphis. And then also Dr. Joe Verone in Houston, and then Dr. Jose Iglesias from Hackensack. Now, the 5 of us, we came together early on in COVID, and we've been trying to figure out this disease. And I got to tell you, we came up with a protocol, and I want to talk about that protocol, but with some other issues that I think the healthcare system needs to be aware of. So first of all, let me just tell you about some of the results of our protocol. So members of our group have now treated in excess of 100 hospitalized patients with our treatment protocol. And we're going to report that nearly all survived. The 2 that died were in their 80s and had advanced chronic medical conditions. None of the patients had long stays on the ventilators, none are ventilator dependent, and most of them had short hospital stays and were discharged in general good health. And so I'm going to say that is good news. Many people are going to be skeptical and ask about that. But let me talk about a little bit more about why we are seeing that. So the first thing is I just want to say how troubled we were. I appreciate your comments, Senator Johnson, about how we're all doing the best we can with the data we have. And so it's hard to point fingers, but I have to say that we're a little bit we are dismayed by the lack of a proposal for an effective treatment protocol. There's 3 critical things that we've seen over the last month that we really want to talk about. So number one, and again, I do not want to diminish the value and the expertise of our national healthcare societies and international healthcare societies like the WHO and the CDC. However, I think those are bodies that are built for peacetime and not for war. And we're at war right now with this virus. And one of the main issues that we've seen is that they initially came out, all of the national healthcare societies came out with recommendations that focuses on supportive care only, which is generally you give Tylenol for fever, you treat symptoms, you might give a little hydration, nutrition, and you give oxygen and ventilators for support when they can't breathe. And that's reasonable for viral syndrome, but this thing is different, number one. Number two, that strategy is failing. I don't think I need to spend a lot of time showing how badly that's failing. The mortality and morbidity rates of this disease are unprecedented. I've been doing critical care for a decade and a half. I do not see mortality rates associated with any severe illness that I see in this one. Supportive care is not working. We're just trying to put a call out to the world to rethink this supportive care only strategy. So that's one major concern we've had. The second is we want to call attention to the world to what we think is a tragic error in analysis of medical data. And that is the fact that all societies from the beginning of COVID have advised against the use of corticosteroids in COVID-19. We think that is a fatal and tragic flaw. And I will tell you why. One of the members of my group, Dr. Umberto Meduri, who's probably the world expert on corticosteroid therapy in critical illness, 3 weeks ago, he published a paper along with 5 other internationally known experts. They published a paper in Critical Care Explorations, which essentially reviewed the role and impact of corticosteroid therapy in all the prior pandemics, including the coronavirus pandemics of SARS, MERS, and H1N1. And contrary to the conclusion of the reviews done by all those national societies, they showed that in the 2 largest and most carefully executed studies of all of the impacts of corticosteroid, that corticosteroids are actually life-saving in these severe viral syndromes. They showed drastic reductions in mortality in anyone who had anything beyond mild disease. You shouldn't use it early as an outpatient, but once you hit the hospital, it's life-saving. And just this week, we're starting to get even more really impressive data showing the importance of corticosteroid therapy in these syndromes. So for instance, just this week, Surin Dragici, he's the CEO of Advaita Bioinformatics. And this is fascinating stuff. And this is about as cutting edge and futuristic medicine that you can imagine. But they have this sophisticated artificial intelligence platform called iPathway Guide. And what they did is they cultured human cells and they infected them with coronavirus. And they were able to analyze the genes that were activated by the coronavirus. They were able to do this with multiple viruses. And what they saw is that in the coronavirus cell types, the amount of the types of genes that were activated, they were able to match that against medicines that suppress the activation of those genes. And the one drug that they found that perfectly met the ability to counteract that gene activation was methylprednisolone, which is a corticosteroid. At the same time that they did that, Dr. Mayur Ramesh at the Henry Ford Hospital, he's an transplant infectious disease expert and immunologist, he implemented a methylprednisolone protocol. Their study just came out this week. And what they showed, and I talked to them in personal communication, is once they started using methylprednisolone, their needs for ventilators went down, their mortality went down, they're reporting this in a study that's right now just a pre-publication, but in over 200 patients, they saw dramatic effects. He said the entire environment changed. There was less codes, less need for ventilators. Their ventilators peaked and decreased. So they came out of a mass casualty environment to a much more controlled condition. And then right now, we're also getting word that there's a paper under review from our colleagues in Spain, critical care experts, all of them, who are now reporting that when they use methylprednisolone therapy earlier and longer than in the Henry Ford study, they're showing absolutely dramatic reductions in mortality. So those mortality rates that you're seeing, we think that there's a really strong answer to that, and we need to change our treatment strategy, which was one where we did not use corticosteroids, which we think are critical, and we want to use them. You know, again, this is the standards of medical evidence have changed a little bit in this crisis, and so I'm going to use some Facebook posts, but these were posts that were posted anonymously by doctors who are in the middle of this surge, and this is what one of them posted 2 weeks ago. This is a hospitalist from Southeast Michigan, and he wrote, "We floundered for 2 weeks, lots of codes, intubations, and death, maybe 15 discharges. We started steroids and discharged 250 patients. Less intubations, less codes. And the ones that ended up on a ventilator, not as serious. If they have chest x-ray or CAT scan changes, start steroids. If they are hypoxic, start steroids. If they are ambulatory and hypoxic, start steroids. This completely changed our trajectory. Steroids are a game changer. This critical efficacy is being noticed more and more around the world. We're seeing it pop up in new protocols and guidelines." Another post from a doctor in New Orleans who also got inundated in the surge, they found, he writes, "I'm here in New Orleans. Since we started using steroids, we were able to free ventilators and get elderly patients out of the hospital without needing a ventilator. Patients that were obviously crashing quickly, who we had to have end-of-life talks with, were able to walk out of the hospital. At no point did any of our patients worsen because of steroids. These patients shed viruses 4 weeks later with or without steroids. The virus doesn't kill anybody, it's the inflammation that does." You know, so those two things that I just reviewed, which is one, the fact that the supportive care only is failing. Two, the lack of steroids may be a critical absence in the treatment strategy of these patients. And then number three, the other thing that we've seen all around the world in many institutions, in medical journals and editorials, is this constant cry for randomized controlled trials or prospective trials. Listen, we in our group, we all know the critical need for data and trials, but we think there's an overemphasis, and we're forgetting some of the ethics of doing research in a pandemic when patients are dying and they're very sick. And I want to remind us of a few ethical principles that the world has agreed on. So number one, the Declaration of Geneva of the WMA, which is the World Medical Association, binds the physician with the words, "The health of my patient will be my first consideration." Number two, the International Code of Medical Ethics declares that a physician shall act in the patient's best interest when providing medical care. And then most importantly, this is where everyone's getting confused, is that this idea that what we're doing is unproven or experimental therapies. I want to call particular attention to Article 37 of the World Medical Association Declaration of Helsinki, first approved in 1964 and most recently approved in 2013. And in that Article 37, which is titled Unproven Interventions in Clinical Practice, it reads, and I paraphrase, "In the treatment of an individual patient where proven interventions do not exist, a physician may use an unproven intervention if in the physician's judgment it offers hope of saving life, reestablishing health, or alleviating suffering." You know, having said that, let me just talk about what our group did. And I'm sorry if I'm going a little bit over time, but this is what we did. So myself and Dr. Marek and Dr. Baduri and Dr. Iglesias, and Dr. Verone, we got together early on, and all we did is talk COVID 24 hours a day. We exchanged emails and papers and clinical discussions. Probably my biggest contribution to Dubuque is that I am a New Yorker. I've trained with, I've been trained by, and I've trained almost every person in every ICU in New York City. And from the beginning, while I was in Madison preparing for the surge, I got to talk to them each and every day. And the accumulated clinical experiences, the impressions, the responses to different treatment strategies, we all got to observe. And we convened a group and we came up with a treatment protocol. It's based on decades of our experience at taking care of patients, our research, as well as hundreds of publications. What we noticed was three things that I think people are not recognizing, is that the way that this virus is killing people and causing all these organ failures is there's three major pathologic processes that we're seeing, which is this state of extreme hyper and dysregulated inflammation. Some people are calling it a cytokine storm. That's number one. Number two, we're seeing hypercoagulability with frequent and excessive clotting. And number three, we're seeing this outsized hypoxemia, which approaches to treating that have sort of been evolving, but I think we failed in the beginning. And so based on those three processes and based on our knowledge of therapies and therapeutics, we came up with what we calling our Math Plus protocol. It's on our website. It's COVID19criticalcare.com, but I'm going to go through it really quickly. Number one, the three critical medicines is methylprednisolone. I just gave you some of the evidence and some of the rationale why that's critical. We know it worked in SARS, MERS, and H1N1. And the fact that we're not using it here, I think, is causing some of this needless death. So methylprednisolone, number one, it's a powerful anti-inflammatory drug that we use to suppress the immune system and prevent organ damage. This condition in COVID-19, which is the cytokine storm, a corticosteroid is the standard recommended treatment accepted around the world for cytokine storm. Ascorbic acid, although known as vitamin C, everyone dismisses it as a vitamin. Those of us who use it and know its physiology and its potency, it's not only a vitamin, it acts as a stress hormone in fighting off infections. It's critical and has synergistic capabilities along with steroids. And so we strongly promote that. It prevents the development of leaky blood vessels within the lung, and it avoids the development of lung failure. It should always be used when paired with corticosteroids. Heparin is another one. It's a blood thinner. We're seeing excessive blood clotting. Almost all centers and institutions around there have promoted the use of some amount of blood thinners. Some are more cautious than others. Some are more aggressive than others. But we all recognize the critical need. And then the last thing is what a lot of us got wrong. I'm going to say the University of Wisconsin, we didn't. I'm going to toot my own horn here, but we avoided the early intubation. Early intubation with these patients is harming them. The machine makes the disease worse. And so we should try to avoid intubating until last resort. And as we do that, we are seeing that we're able to alter the trajectory of these patients away from the ventilators, and we're seeing lives saved. So I'm just going to summarize by saying our treatment is not unique. We're starting to see it pop up in centers and protocols in countries around the world. The most recent Italian guidelines were extremely aggressive. They're mandating an overall focus on treating inflammation with tocilizumab and mandatory steroid use early on in the disease. They're saying to do it as soon as someone's oxygen level drops. And this is what I want to say. This is the last tragedy. And I know that probably what I've said is a little bit heated. I'm emotional, but this is absolutely a calamity that's going on in medicine. But I've been in New York City for 2 weeks trying to treat these patients with COVID. Either I've been inundated with patients who are chronically on the vent who are dying of end-stage fibrotic lung disease, or I'm seeing patients who are crashing into my ICU, but as opposed to a month ago where they were coming in with these mild abnormalities on chest x-ray and maybe mild abnormalities in their oxygen intake, now we're seeing floridly abnormal x-rays with very advanced disease. I'm throwing the book at them and it's not working. I have to emphasize that the timing of initiation of this therapy is critical. The world needs to know this. What happened here in New York is that initial surge caused so many terrible reports of patients being unattended to, running out of resources, not enough physicians and nurses. And now the population is scared. They're not coming to the hospital early enough. And now when they're coming, they're so far advanced that the medicines don't work as well. And so we need to get the word out that, things are better on the ground. We're definitely much more stable in the hospitals. We're much more resourced. We're regrouped. We're ready to take care of patients, but the patients have to come. If they wait at home with these symptoms, we're not going to be able to save them. And so I just want to finish by saying, finally, our group, and what we've tried to do is put together an effective, sound, physiologic, and evidence-based protocol, and we've been trying to disseminate it. We've sent it, it's gone to the White House 3 times now. A month ago, it was given to a member of, I think, Kushner's team and brought it to the White House. They apparently liked it. However, they got pushback from the NIH and the CDC, who I think were cautious on the steroids. And then 2 weeks ago, Dr. Marek was interviewed by Newt Gingrich, a former speaker, Newt Gingrich, who also brought it to the White House. We still haven't heard. And then this week, our protocol and our group's efforts were published in the American Spectator, and the editor of the American Spectator also brought it to the White House. We still haven't heard anything. We do think that we need to develop a national effective treatment strategy. And with that, I think I'm just going to end there and just say we're experts in our field. This is what we do. We know how to take care of patients. Let us take care of these patients. We know that these medicines are sound. We know the safety profile. Everything in our protocol is safe. FDA approved, has been used for decades. Yes, that's off-label, but we do off-label stuff every day. And with that, I probably took too much time. I'm done. Thank you.
Well, first of all, thank you, Dr. Corey, for just being a doctor, for your passion. I can tell you now your protocol has been sent to the White House 4 times. I sent it to Mark Meadows today with the text that I pray somebody in the White House will pay attention to this and give it very serious attention. So again, thank you for that. Again, thank you.
The hidden agendas of duplicity, propaganda, and conspiracy have consequences on us all. Using health fears against the people is despicable, and especially the elderly. The fact is that this previous doctor showed us how COVID-19 was cured with steroids in New York since April 2020. So what are we, the people, supposed to do? Well, their actions will expose and judge them, and you will witness firsthand the propaganda. This next doctor works for John Hopkins and Bill Gates' Event 201 pre-pandemic plan.
The director of the Center for Health Security at the Bloomberg School of Public Health within Johns Hopkins University. Dr. Inglesby is also a professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Prior to that, he was chair of the Board of Scientific Counselors, Office of Public Health Preparedness and Response at the U.S. Centers for Disease Control and Prevention from 2010 to 2019. Dr. Inglesby received an MD from Columbia University College of Physicians and Surgeons. Dr. Inglesby.
Good day. COVID-19 has done great damage to our country, firstly in terms of people sickened and lives lost, and secondly in terms of the terrible economic consequences and job loss. As a sign of the speed of its spread, as of 2 months ago on March 6th, there were 200 people diagnosed with COVID-19 in the U.S. In the absence, as of yesterday, 1.19 million Americans have been diagnosed with COVID, and more than 71,000 people have died. In the absence of social distancing, this epidemic doubles in size approximately every week. That's the data that we have up until social distancing began. In the last month, more than 200,000 new American COVID cases have been diagnosed every week. We have a national plateau of about 25 to 30,000 new cases daily. We had more than 2,000 deaths yesterday from this virus, and the great majority of U.S. deaths have occurred in the last 30 days. Yesterday, 33 U.S. states reported more than 150 new cases of COVID in their states. 17 states have daily case counts that are still on the rise. On the other hand, 10 states do have a 2-week decline in numbers, which is encouraging. And states that have had 2-week declines and meet other conditions for safe reopening could be the least risky places for initiating reopening process. States reopening without safe conditions could be at risk for a rapid acceleration of cases. Our team worked with colleagues at the American Enterprise Institute to publish a report recommending 4 conditions that should be in place before a state eases social distancing. The first is sustained reduction in cases for at least 14 days. The second is capacity for hospitals to give all patients with COVID the full standard of care. The third is the capacity to test all people with COVID-19 symptoms, whether they're mild, moderate, severe. And the fourth is capacity to conduct active monitoring and quarantine of cases and their contacts. These conditions are largely consistent with the criteria and core state preparedness capabilities in the White House guidance report called Opening Up America Again. 38% of adults in the US, or 92.6 million people, are at higher risk of serious COVID infection, given their age of 65 or older or underlying health conditions. Some have called for focusing social distancing and mitigation efforts only on this high-risk group, but there are no feasible approaches to separate off this 1/3 of American adults. Most estimates of the infected mortality rate by epidemiologists and public health organizations are that this virus causes something on the order of 0.5 to 1% infected mortality rate. If this virus transmitted widely without social distancing, and high numbers of people got sick with COVID in the same period in a given city or state, there would be the potential of overwhelming healthcare facilities, outstripping available ventilators, and or the people needed to run them. We came very close to this scenario in New York City last month. If that did happen, and there were not enough ventilators to go around for the people with COVID, the infected fatality rate, which I just noted, could go up substantially, as it appeared to do both in Wuhan and in Lombardy in Italy. It's very important to look at the experience of Wuhan and Lombardy and New York City in dealing with COVID. In each of them, this virus was rapidly able to go from being nearly invisible to causing a complete health crisis in a period of weeks. That pattern is absolutely nothing like influenza or any disease we have dealt with in modern times. In the time ahead, we have to find a way to cope with the severe potential public health toll and the severe economic toll of this virus in the US. Some states are in a safer position than others to cautiously start to move ahead on easing social distancing. Any state that does should recognize that COVID could rebound sharply in the time that follows easing social distancing. And those states should track hospitalization rates, ICU bed rates, ventilator rates, and deaths very carefully and be prepared to change course if numbers substantially worsen. And leaders in those states should communicate clearly to the public that individual physical distancing measures, distancing between people, cloth mask use in public, avoiding gatherings, will all remain critically important throughout this entire period until we have a vaccine. Keeping the epidemic from rebounding and causing new waves will take collective great action on the part of the American public. Thank you.
Thank you, Dr. Inglesby.
Now, do you see why it's so important for we the people to stand up, take our power into Power Shift together? If you want more information, please go to thepowershift.ca. Find out what you can do and how you can help, and e-sign your Free Citizens Convention of Consent, either in French or in English. Thank you. We're now live on. Okay. Okay, what was that? Okay, so welcome back, everybody. So I hope you enjoyed that. We're now live on. Hang on, what's going on here? Okay. There we go. That was the other page. Okay. So now we're back to normal. Always a screw up. Never fails, but it keeps us smiling and, laughing a little bit. Got to laugh at ourselves. And, the reason why I want to show you is that, I made that video together because I really wanted the people to see the difference, in the words being used, the propaganda, these doctors who are really on the front lines, fighting this disease, who have no agenda other than being forced to add COVID. When they're talking about the numbers, we have the documents where, they've been given $100 billion. Who speaks about donating $100 billion? Bill Gates. $100 billion to inflate the numbers of C. difficile, because what they can do is what the hospitals, the doctors were saying, well, they're being told that even though somebody died of something else, they have to write COVID as an assumption, even if they haven't tested them. So they're assuming they have to write COVID because they get in the US, they get $13,000 for an assumed COVID case and mortality. So they classify that under death from COVID. And if they actually tested positive for COVID, they actually get $39,000 and some dollars, okay, per patient, and the ones they put on ventilators. So the hospital management, okay, really need to look at themselves very deeply, because this is a fraud being committed at the hands of the management of these hospitals, not the doctors and the nurses, because if they don't do what they're told, they will be jobless. So when these doctors come up and tell the truth and say what they're doing, and then you have people like Dr. Fauci and others worldwide who are saying, oh, it's propaganda and it's not true. And you really have to question their motives, because right now they're trading our health and welfare and our economy as their gameplay. There's an end game here, people. And as long as we are locked into our homes, and now here they're trying to extend us till June or July. Why? What do they need? When we look at everything comes back around to monitoring us, using this pandemic to instill vaccines and giving the reason of needing vaccines before you're let out of your home to go to work. And they're going to test everybody who's positive, but they also have to test the ones who never got tested. They're not saying that to anybody yet, but if you want to go back to work, you want to go outside and play, you want to be able to do, get your life back, you're going to have to dance through hoops and do what the government tells you. So my dream is that we clean this mess up, explain it as best as we can, connect all the dots, ask all the questions imaginable. Please, people, question everything. I no longer trust anything or even anyone, okay? And, if my mother would tell me, oh, Nicole, I heard this, so-and-so told me this, oh no, this is how it is, I wouldn't even trust her, because I'd have to say, where's the information, Mom? Can I read the information? Where did it come from? Because we're at a point in life where we can't trust anything. No media, no government, no politician. And I mean, now what we're seeing is they're jumping back and forth in the blame game between China and the United States. They're itching for a war, people. But the thing is we don't need to go to war. We need the people to rise, because this war is against us. Every man, woman, and child in this country, in all countries on the planet. And this is serious. So it's up to you to step it up and do your part, because as that video says, we can't save your country and your future without you. We have great information, great facts. This is all research that's been done according to government documentation, according to studies that were done by medical professionals. And, you know, like in regards to Canada, our Canadian Constitution is a scam, but it's a legal scam. So you have to be able to debate it in court the proper way. So this is what we've been doing in the last 11 years. And, you know, Rhonda and I have been working nonstop, you know, to put a court case together, and we were supposed to refile, but then COVID happened. And hopefully now we'll be able to refile ASAP. But the lawyers in Canada need to step it up as well. Not just the doctors and the nurses and everybody in the medical field who knows what's going on, or even doesn't know what's going on, but are, you know, ask questions, research what the doctors have found, you know, and check things out. Find out how much your hospital is getting paid per patient. Assumed cases. One couple went forward, their son committed suicide in the United States, and they turned around and, you know, they had no choice but to accept the COVID. They put down COVID. He committed suicide. But then there was a question of, like, when they want to make us think about it, said, yes, but you're not going to be able to get your insurance, your life insurance paid. Okay. So anyways, everybody's trying to keep everybody to keep their mouths shut, but it's no time for that. Okay. You need to stop being afraid. We need to face this on with facts, with real legal facts, okay? Because we're going to have a lot of professionals out saying, the doctors and, you know, the two doctors that came out of California to begin with, I mean, they made my day. And then now Dr. Corey and their group, and, you know, this one doctor that I saw in the protest in California, where they were saying that this gentleman was speaking for thousands, and you don't see this on TV, but he was saying that he was speaking for thousands of doctors who are demanding that the cities be reopened and the country be reopened. And there's no reason. Okay, even though we think, you know, they'll say, oh, but what if there's more cases? Well, listen, more cases. Where are we going to draw the line when it comes down to our freedom and our future? Is being good little, you know, men and women and girls and boys, listening to our government and being in fear, having no balls to stand up? What's it going to take for you? Like, what does freedom mean to you? All of a sudden you can't go out on the street because why are they holding, you have to ask questions. Why are they holding us into our homes, stuck into our homes? They need the time to install the 5G everywhere. And if you look at the World Economic Forum, 5G is in there, and 5G is going to be able to follow and track you. That's all of what this tracking thing is about. Oh, you might have come into contact with somebody. Now we need to track them, and we need to know everywhere you go in case you know, you're going to have different bouts of COVID or different bouts of whatever they make up. So because we can't trust our own governments, our politicians have been in cahoots. These are teams, okay, different teams, one player at the top, puppeting everybody. And this is to make people confused, making people doubt. And the only thing that you should never doubt is your power as a citizen. This is what we need to focus on, is our power. your power, your children's future, their power. Because as Canadian citizens or US citizens or Luxembourg citizens or France citizens or England citizens or, Ireland, Africa, Australia, everywhere, the people are supposed to rule. So, in a roundabout way, they're going to get caught in their lies for trying to launch a globalization against our will, against our knowledge, and using a medical emergency to keep us under control and to dictate to us. The bad thing about this is that legally, they have the power. But until the Canadian people decide to make a political, this has to be a political move, which is what the Citizens Convention of Consent is about. It is a political agreement, a legal agreement, but it's political. Okay. When we do something collectively, it becomes political. It's a political action. So we need to get the people together on the same page for a sound and legal action. So this is why we have the power shift. It's time to power shift final decision-making authority out of the hands of the governments and into the hands of the people. And this is why I want to make these videos, so to make it clear to everybody. You can't just turn around like in Canada, the provinces or even the states, okay? Because the way government works, okay, and after that, I'm going to get back to this COVID thing, but the way the government works is that in Canada, okay, even though we are a constitutional monarchy, we're still ruled under corporate law, and we're supposed to be under common law. Like when it's things between ourselves, it's common law. When it has to do with the Crown Corporation of Canada, the government is under the Crown Corporation of Canada, and we have in Canada the sole, okay, the corporation sole belongs to Her Majesty the Queen. Well, Her Majesty the Queen has handed over the power to the Canadian federal government. All powers. So the federal government has final decision-making authority, even though our Constitution stipulates our rights, which they can remove whenever they feel necessary. And then we've got the notwithstanding clause. So people tend to forget about that. And, premiers spewing out their mouths about separation, and good luck with that one. Okay? Because you're going to have egg on your face, and you're going to waste everybody's time and energy hoping for a court case that you'll never win. You will never win. You need to have the facts. So in the Canadian provinces, the premiers, okay, along the line, were all bought and paid for and sold everybody out in the provinces. However, it's the provinces that handle the people, and the federal government handle the international affairs, okay? That's how it works. So when a province is saying, oh, they're going to do this, they're going to do that, it's because they got the okay from the top. And then once in a while, they'll say, well, we're arguing between the provinces because the provinces don't want to do this, okay? But if they really wanted to and get really nasty, the federal government can override the provinces any day. But why do they not do it all the time? Why wouldn't they do it? To hide the fact that Canadian citizens only have the rights the government allows us to have, period. And even though there's international human rights, well, they had so much time to be able to, to give us our rights. The governments have to agree to the United Nations human rights. And they've agreed on some of them, but not all of them. Do you know which ones? Do you know who the Constitution of Canada belongs to legally? Not Canadians, not even the government. not even the Queen. So I'm going to leave you to figure that one out. Okay. So when you're looking at Canada, what happened with the citizens? We just joined a government that decided that it was going to rule over this country back in 1931. And they're going to give us the rights that we want. So we joined a government. Okay. The government has the democracy. The government has the power. That's it. United States and France, republics, same thing. The government took, even though their constitution stipulates that they are the sole, they are the sovereigns, the shareholders of the corporation. However, management and executive order belongs to the president and to the government, Congress, not the people. They'll tell us that they'll give us little referendums here and there just to appease us. And now you're going to learn this week in our other segments, actually tomorrow evening, I will go more into more details because we will be covering the global governance issue under the World Economic Forum. Okay, and how they've created this matrix to bring in, yes, the 5G in every country, and yes, open government. And they're going to tell us, oh, but we're going to let you, you're going to be the actors in all these cities and communities, and we're going to ask you your opinion. But at the end of the day, the only one who has the power is the one who has the veto. In open government, is it the people or is it government? Or will it be the world government now? I would say world government. Because if you really read what they've written into their global governance matrix, our governments will only handle certain things, just like the provinces do under the feds. Just like the Canadian government only allowed the Indigenous nations self-governance, but not self-determination. No, 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 no. So we found the solution, the legal solution to getting our self-determination. But we need everybody, and every country does need the same. And we can all set it up. And people need to start looking at the facts, stop believing the media, please, because people have been brainwashed by politicians and by the media into thinking we're all free, yet we're not. And we're only pawns in their Ponzi scheme. Okay. So anyways, now what I'm going to do is I want to show this video with the proof as to what they're doing in the States, these doctors with the steroids, that yes, it did cure a lot of people, and they don't need a vaccine. Okay, so everybody who is, you know, thinking of these vaccines, we don't need it. Okay, so this is Wayne University that you can see here. Okay, and College of Engineering. And this is Wayne State spinoff, Advaita Bioinformatics, identifies generic drug shown to be effective against COVID-19. There you go. There you have it, people. There we are. This paper was written, okay, and they had been using this before, April 30th, which has been absolutely denied by the US government. So is Trump just playing a game with the people? You're damn right he is. Again, 2 teams, so that we are like rats in a maze, and they've got 2 doors for us, and they're trying to herd us into either different way we're going to go, and they've got us. Either way, they've got us. Okay? That's how politics has worked, and historically, it can be proven. So we're looking at this here. I'm not going to read it all, but I wanted to show you exactly, it says Ann Arbor-based company spun out of Wayne State University announced that it has identified methylprednisolone, a generic FDA-approved corticosteroid typically used to treat inflammation and other common ailments, as a drug that can improve outcomes for patients critically ill with COVID-19. Ask questions. Okay, there's a lot of questions, and the reason why I want to do this tonight is because I'm going to be contacting Dr. Corey and then the doctors in California and some of the media, alternative media, to get this out there. We need people, we need to spread this information, because even though they call it propaganda, they're going to have a hell of a hard time proving that this doesn't work. Okay, so now we have the gentleman here, Dr. Soren Dragisi, and he's the one that is spearheading this with Dr. Corey and the others. So I'm going to attach this file, okay, and also Dr. Corey's minutes of the video that you've seen, and you can send that to your friends in an email with the video and whatnot. So, they did this, to try to prove their point, because they were desperate to try and fix this COVID problem. So anyways, I'm not going to keep this very long, because again, we're going to do this by segments, and I just want to show you that here, so that it's feasible, and they've already proven their point. So anyway, now with trying to reach everybody, we need to spread the word. We need to get people to sign their Citizens Convention of Consent. We need the other countries. France already has their French convention ready and loaded and waiting for signatures. We've got Luxembourg that has theirs. I don't know if they're already set up yet. And then we've got a lawyer in Ireland that is supposed to be organizing herself as well. So anyways, things are, I'm so happy. I'm not happy about COVID, but I'm happy about having the solution ready for everybody, and that the COVID, it's a virus, yes, but it's, SARS coronavirus, just another version. Like C. difficile, there's 15,000 strains since it started. So, and then you'll see that this week we'll connect the dots with C. difficile and all this. And, but the bottom line is, everything comes back to these hospitals being forced, the doctors and the nurses being forced to add COVID as a reason for the person's death, when it has nothing to do with the person's death, because they're getting money. They are getting paid to do this. It's a scam against the people to keep us locked into our homes while they set up their 5G network to be able to track us and everything we do, everywhere we go, and everyone we speak to. So if you value your freedom, please go to thepowershift.ca. Sign your Citizens Convention of Consent as soon as possible. It's free. If you have any problems, just contact us, and you can sign this on your phone. If you don't have the internet, you can go somewhere where there is the internet. Guaranteed, somebody with a laptop, with an iPad, with a phone, that you can sign right through your phones and your iPads and your laptops or computers. So we've done our job, and I'm glad to say that, we're ready for this legally. And we're asking the lawyers to, if you value your freedom, and people have to pick a side. It's you as the as one of the final decision makers with all other Canadians and Indigenous persons in Canada when something like this happens, or are you going to allow the government to rule over you, to dictate to you, and to lock you in your homes whenever they feel the need to? The choice is yours. Freedom or slavery. If you choose freedom, please go to thepowershift.ca. Thank you. Good night. And we finally have a reason to smile. Bye-bye.